Good morning, everyone, and today our topic of discussion is Paragonimus westermani, or this one is a parasitic disease, and again, it's a trematode, as we are discussing trematode, and this is also called as the lung fluke. So, we are discussing basically westermani, which is a type of uh, para, paragonome, right? And that's why the condition which it causes is also called as paragonimiasis. Paragonimiasis. So simply like the introduction about paragonimiasis, what is this condition is. Uh, this is a parasitic disease, as we know. It is a trematode, and the genus or genus of this one is basically Paragonimus, right? As I was talking. So this infection is acquired when the human host accidentally consume this one. So as I told you, so this is one of the name of this thing. It is also called as the lung fluke. Okay, and why it is called as the lung fluke? Because it commonly localizes to the bronchioles or the airways, you can say, after ingestion. So the important thing about this condition that pulmonary involvement is the most common clinical implication or complication of this infection, but this disease is often asymptomatic, right? So you can say it's a it causes you can say pulmonary involvement, but mostly the disease is asymptomatic. So now we will discuss like in the clinical features how it present, like what are the sign and symptoms this one gives. Okay, but why this one is important again, like this condition have you can say the same thing, or you can say there is a two intermediate host and there is one you can say the definitive host, right, in these patients as well. So as I told you that this one is mostly caused by like when humans they or the man they by mistake or by accidentally they consume this parasite, they get this infection. So to tell you like how important this one is, basically this one uh, Paragonimus, this is a parasite which affect the mammalians or mammals, carnivores and omnivores. Like carnivores are those which feed on multiple things, and omnivores are those which have like uh, one type of food. But simply all the carnivores and the omnivores which in like all those carnivores or omnivores like whose diet depends on the fresh water, you can say, okay, mammals uh, whose diet you can say includes, right, fresh water, crustaceans, now what is crustaceans, guys? If you know the crabs are crustaceans, or crayfish fish, they are also the crustaceans. So uh, the interesting thing about this disease is what, uh, when I was studying about this disease before making this lecture, I came to know that first time they described this disease in tigers almost 100 years back. And then they found a variety of, you can say, wild or domesticated carnivores, and they found like they have this parasite, or they have the paragonimus. Okay, and the distribution is worldwide. Simply, uh, worldwide distribution is there. Okay, so most of the part of the Asia, most of the parts of the Africa, the most common, you can say, in Asia and Africa, the most commonly identified, um, you can say, the parasite is basically this one. Parasite is Paragonimus wester wester westermani westermani. Okay, so Paragonimus westermani. So basically, this Paragonimus westermani is the one we call it as lung fluke, right? So now, like, in all over the world, they found a lot of species of this one, more than 50, by the way. Okay, and they found like more than 50 species are basically connected with the human disease. Uh, Now, to tell you, for example, uh, this condition or this parasite is endemic in many areas. For example, in Central America, this one is called as Paragonimus mexicanus. Okay, so Mexico, from Mexico, they make it as mexicanus. In China, they name it as Paragonimus scourgabini, and in Japan they call it as Miyazakiai. Okay, in Japan they call it as this one. So simply, in Africa, West Africa, they call it as Paragonimus bilateralis, bilateralis. Okay, so simply in Africa it is called as Paragonimus bilateral lateralis. Okay, so this one is the one. So like simply, you don't have to remember these all things. Like, why? Because uh, it depends like from the region to region, because most of the more than 50 species they have identified. So what we will discuss is this one, westermani, right? So as I told you, like, how this disease is presented is basically when the humans, uh, they ingest this one, accidentally. So first of all, again, I will show you that CDC thing, okay, about this one. And again, in this CDC one, you can see the humans, as I told you, they are the one which are um, definitive host, not just the humans, guys. There are many others like cats, tigers, dogs, pigs, all the animals which can eat crabs, right? And then there is first intermediate host, that is snail. They have not drawn the snail over here, but it is a snail. And then there is the second intermediate host, that is basically either crayfish or either crab. And that's why I included this photograph also. See, like, first of all, they identified that thing in the tiger, and see the humans, and first intermediate host is the snail, and the second intermediate host over here is the crab. Okay, but I like this one because they are showing us the infective stage over here and diagnostic stage over here. So that's the important point, why I go for the CDC one, uh, because it makes easy clinically. So now, simply, how the humans get infection, things are simple. The humans are going to get the infection when they are going to ingest uncooked, or you can say not sufficiently cooked freshwater crustaceans. Humans, they eat crayfish also, humans, they eat crab also. So see, the story starts from here. The human ingest inadequately cooked or pickled crustaceans containing what? Simply, they have the same name everywhere. Okay, Metacereaceae. So see, they have like they're showing you over here, and the human have ingested this one. Okay, now they have done what you can say some studies. You know what they did, like they feed this thing to the rats, and they found like after feeding the rats on this one metacereaceas, what happened, like they found that the rats, they developed the same disease in the lungs like humans. Okay, but they also found the same thing in their muscles as well. So now what you can say, different countries have different type of things. For example, in Asia they found like when the people they uh, like, as I told you, when they feed this thing on rat, they found this infection in the lungs of the rat, as well as they found the same thing in the muscles of the rat. So now they found like why they conduct the studies, because they found like in different regions. For example, in Asia, many people they eat, you can say, wild boar, you know, undercooked boar, so they may get this condition. Okay, for example, in USA, in America, you can say, or North America, to be more specific, in United States, what they found is the people who eat imported meat from the regions, which where this parasite is endemic, they may contract this condition. Okay, so simply, like the crayfish and the crabs, nowadays, because there is more and more industrialization, so you can say many of these things, they are frozen, and then they pack them, and then they ship them uh, to the other places, right? So okay, before going on that thing, guys, I wanted to show you how it looks like. Now you can see over here, um, this one is like Paragonimus westermani, right? So you can say like this is an egg-shaped worm, right? So this one is egg-shaped. It is around 1 centimeter. See, 1 centimeter, or you can say 10 millimeter, right? 10 millimeter or 1 centimeter in length, right? And 5 millimeter or half centimeter broad. So 1 centimeter by five millimeter. Okay. So it have like these spines. It have the ovaries. It have the testes. It have the uterus. Again, it have the intestinal cecum, and you can see it's a leaf shaped, right? So again, what we are studying, guys, we are still studying trematodes or fluke worms. So this one, and the lifespan of this parasite in human is around 20 years. So it have a long life. Okay, again the same one under the microscope, right? So this is how it looks like. Now the important thing over here. Uh, so simply, like I was telling you the story, like this crabs and this crustacean, simply crabs or crayfish, nowadays they can take it from fresh water, no matter, they are going to catch it in Thailand, they can export it to any country. So now what they found, like due to this thing, this condition have infected millions of people worldwide. Okay, what is suspected like this, the risk of acquiring this infection is like around 200 million people worldwide. So simply, what happens is like uh, you can see over here, um, the adult worms, which are here. See, adult in cystic cavities in lungs lay eggs which are excreted in sputum. Alternative eggs are swallowed and passed into stools. Okay, so see what happens, guys. Simply, we will start from here, right? The human, they have ingested this thing. It will go into the GIT. It will go into the GIT, And what is happening in duodenum, same story. There will be egg cyst, or you can say the larva is going to come out, right? So this thing will happen, and simply when the what you can say larva will come out in the humans, right? So what the larva will do is simply um, it is going to uh, penetrate or go through the intestinal, you can say, uh, it is going to pierce the intestine, right? And it will reach the lungs. Now, in the lungs, what will happen uh, after penetrating the gut wall, it will reach the abdominal cavity, and from the abdominal cavity, it will migrate from the diaphragm. There's a diaphragm over here, and it is going to reach to the lungs. It will lay down in the bronchi, where it will take 2 to 3 months to change into this adult form or the adult cystic form. Okay. So now, guys, okay, not just the lungs, by the way, it can reach to the other parts of the body, but mostly it is present in the lungs. Now the important thing over here is what? Whenever it produces eggs, so the eggs will come through the airways, and the person can swallow that eggs in the GIT again, number one. Or the person, when they feel the secretions, we can spit them out, or what we can call it as sputum. Okay, so see, from the humans, it can be spread through the feces, or it can be thrown out in the form of sputum, or we call it as phlegm. The normal term is phlegm. So the phlegm is the one which will give the unembryonated eggs. So again, these unembryonated eggs, which are either coming from the feces or either coming from the sputum or the phlegm, they take around 2 weeks to mature in the fresh water. Okay, and once like they are going to mature, see, uh, they are called as miracidia. So they hatch and then they penetrate the snail. So the snail is the first intermediate host. So see like what's going on in the snail. Uh, so it takes a lot of what you can say weeks, and see sporocyst and all these things, and these things will be released, cercariae. Okay, so when the cercarias are released, what will happen, like these cercarias again, they will be in the fresh water. They are going to infect the crabs or the crayfish. Okay, and once they are in the crab or in the crayfish, they are going to form the encest form, which can be ingested by the human. So this is how their life cycle runs, right? Now, um, this is the maturation, and see, now this is the infective stage and this is the diagnostic stage, right? So like whenever this one is it is going to invade the human, it is going to uh, like the immune system will activate, and the immune system will also try to uh, limit this infection as well. Now, what are the clinical features of these conditions? Because this one, in fact, is present in the lungs. So, what are the clinical features? Okay, we are going to discuss over here. So now you can say the first thing to mention over here is there is wide range of clinical features. Wide range of clinical features are there. Wide range of clinical features are there. Okay, some of the patients, they have very few symptoms. Number one, okay. Some of the patients, they do have symptoms, but the most common finding in the labs is eosinophilia. Eosinophilia, or you can say like the eosinophils will be raised, right? So what they found, like when they check a lot of patients who have this infection, they found like the most common type of abnormality which is present in these patients is eosinophilia, basically. So that's why this is a very important thing, and I'm writing it on the top. So simply, symptoms depend on the parasite burden. If the parasites are less, maybe there will be no symptoms. If the parasites or the disease burden is more, there will be more symptoms. Okay. So, uh, and most of the symptoms are due to inflammatory response by our body. Okay, like our immune cells, which are going to activate against this one. Okay, so this thing is important. Now see, guys, the things will make sense in this way. See, there could be symptoms when the larva is penetrating the intestinal wall. So there could be abdominal pain. Same story. There could be mild fever. There could be blood in the stool, right? Everything makes sense, right? So now, uh, of course, like when the larva is going to penetrate the intestinal wall, of course it will cause hemorrhage over there. And when it is passing through the peritoneal cavity, it can cause hemorrhage over here. When it is penetrating through the lungs, for example, it can cause uh, hemorrhage over there. When it is going to enter inside the lungs, it is going to cause damage over there. So you can simply say, like when it is going to penetrate the lungs, there could be pleuritic, pleuritic type of chest pain. Pleuritic type of chest pain, like which is due to pleura, irritation to the pleura, right? So now the important thing over here. Now, when it is in the lung, the patient can present with hemoptysis, okay? Blood in the sputum. Hemoptysis can be there, right? Again, this thing makes sense. So you can say like this is the most common pulmonary symptom in these patients. So this thing, and of course, like how we diagnose these patients is simply by examining the stool or by examining the sputum. Okay, so in the diagnosis, for example, like I think these things will go side by side just to make you understand this thing in a better way, right? So until now we have discussed about the lungs and about the sputum, about the lungs and about the intestine, and also about the peritoneal cavity from where the larva is going to pass, right? So the diagnosis, see, uh, we can do microscopy of the sputum. Okay, we diagnose tuberculosis also in this way, or you can say you can do microscopy of the stools or feces, right? So of course, like this thing is important. Now, for example, we can also examine the pleural fluid. Okay, pleural fluid is present in the pleural cavity between the visceral and parietal pleura. So we can take a small fluid from the pleural area and we can examine that. So we can found like that it will be have low pH or low glucose and elevated proteins. Basically, these are the findings which we get in bacterial infections, anyways. Okay, but there is something called as bronchoalveolar lavage. Bronchoalveolar. When the patients, they cannot produce sputum, we can say we can take bronchial washings, or we can take the washings from the bronchus and the alveoles, and we can examine them for the X. Okay. Now, some of the patients, when this uh, parasite it is passing through the peritoneum, it can leave some of its seedings in the peritoneal area. Okay, so for example, what will happen that when it is going to leave its, what you can say, seedings in the peritoneal area, there will be signs and symptoms related to that. Okay, now not just these things. Okay, and as I told you that it is present in the lungs, but it is not like this because many of the people, they do present with something called as cerebral involvement, okay, in which what they found, like this paragonomiasis is basically reach the brain, okay, and brain is basically the most common extra pulmonary site where it can reach. Okay, other diagnosis which we can do is like we can do go for radiological imagings, okay, same like before. So what we can do, like, we can do a chest x-ray, right? We can do a chest CT scan, and things like this. So CT scan of this patients, it is more interesting because sometimes, on CT scan, so we can do x-ray. Just to tell you, we can do CT scan. In CT scan, sometimes they found something called as worm cysts, okay, like the cysts which are formed by this worm. Okay, so this things can be present. So radiological examination, simply imaging can be done, but guys, it may take up to 3 weeks for the flukes to mature and produce eggs for microscopic diagnosis. Remember this thing as well. And of course, like last but not the least, and this is the thing which is present in almost all the conditions which we study, is again ELISA. And again, I will say you the same thing. If you don't know about ELISA, read about that to understand what is that. Basically, it is enzyme linked immunosorbent assay. Okay, and simply what we can do is by ELISA or by this thing we can detect the antigens. Okay, there is intradermal test for this organism is also there, but we don't depend much on that one. Okay, so simply we go for ELISA, which can detect the antigens. Okay, and it have a good specificity and sensitivity, especially. Uh, and what ELISA catch in these patients is basically something called as um, parasite excretory secretory antigens. Okay, so this is how we diagnose. And once the diagnosis is done, guys, so what is the next thing um, in these patients is and wait, I put this thing. Oh yes, one thing which I mentioned before, but CBC. Okay, so CBC will show what? Eosinophilia. Okay, so treatment, how to treat these patients? Simply, what you can say, uh, the treatment for these patients is very simple drug which we talked about before is called as praziquantel. Okay, so praziquantel can be given. It's an oral drug. We can give them 3 times a day for 2 days. Anyone who have pulmonary disease, and sometimes like when someone have extra pulmonary, or you can say some other areas like brain is involved, we can give it for longer duration. If you found the cyst, you can go for surgical resection, because remember, like, of course, in that case we have to do that. Praziquantel is a very interesting drug, guys. When you will study pharmacology, you would know about this one. So it has like some side effects like headache and drowsiness, which is like the side effects for most of the drugs. But it is a well tolerated drug. And the cure rate is very nice, more than 95% cure rate is there. So this one is like, is the one, which we use. Okay, and the interesting thing, like the drug which we studied before, like triclabendazole, which is the treatment for the previous condition, uh, fasciola hepatica, that drug is basically used in animals to treat this infection. Okay, so this thing is important. So How we prevent this condition, or prevention or prophylaxis, as we have discussed before, and we always discuss about all these parasites. Now, of course, like the same thing, uh, under like should take properly cooked food. Okay, so they like someone everyone should avoid, especially undercooked crabs or crayfish. Okay, if it is undercooked, of course, like the parasite may be still living. And one of the things, the food authorities should, uh, what you can say, monitor the imported food, of course, so that like these things should be stopped. And of course, like treating the water containing uh, crustaceans. Okay, very important thing again, improved sanitation. That is very important. When we improve the sanitation, of course, like if you will see, when the feces or the sputum, all these things are coming in contact with the fresh water, the problems are arising. So of course, by improved sanitation, we can limit the transmission, not just in humans but also in animals. Okay, so of course, like improved sanitation is very, very, very important, and that's what is going on in the developed countries. Like they have good sanitation, so they have less diseases. And in the underdeveloped world, like there is less, or you can say not proper sanitation is there, so they have more and more cases like this. So anyways, guys, thank you for listening. That's all about Paragoniamiasis, and what we were studying is Paragonimus westermani. Okay, the names are difficult, of course, difficult to pronounce, and uh, sometimes, of course, the pronunciation of these things are very, very, very difficult. So I will see you next week, guys. Thank you so much.